Some of the more common STIs are caused by bugs, microscopic bacteria and protozoa. In the previous video, most of the students we asked correctly identified chlamydia as the most prevalent STI amongst this population. But how common STIs are vary between places and populations. Recent global estimates are that over 4% of women and nearly 3% of men have chlamydia. These figures show the rates of 4 curable STIs, chlamydia, gonorrhea, trichomoniasis and syphilis in different regions of the world. You can see here that rates of different STIs vary hugely between regions. As many as 7.6% of women in the Americas are estimated to have chlamydia, but the rate's fourfold lower at less than 2% in Southeast Asia. Chlamydia and trichomoniasis are the most common STIs in women across all regions, with chlamydia the most common in men. Chlamydia, gonorrhea and syphilis are caused by bacteria. These bacteria multiply in the host and can infect their sexual partners. Bacteria that cause chlamydia and gonorrhea are shed in an infectious discharge, and contact with the discharge is how the infection spreads. Syphilis can be spread by skin-to-skin contact. Trichomoniasis is caused by protozoa, tiny parasites. Many men and women infected with the trichomonads are asymptomatic, that is, they don't have symptoms. Trichomonads can only live in the human urogenital tract. These bugs can infect the urethra in men and the urethra and vagina in women, causing pain during urination or sex in some people. A vaginal infection can cause women to have lots of frothy and smelly vaginal discharge, which is infectious. The World Health Organization estimates trichomoniasis as the most common STI worldwide, with 142 million new cases per year. It's not common in urban areas in Australia, but not uncommon in Indigenous Australians. It's also common in developing countries, including many parts of the Africas and the Pacifics. These STIs that are caused by bacteria and protozoa can usually be treated with antibiotics. That means that many of these relatively common STIs like chlamydia, gonorrhea, trichomoniasis and syphilis are curable. One of the main effects of long-term STI infections in women is impaired fertility. The bacteria that cause chlamydia and gonorrhea can move up the reproductive tract into the oviduct and cause damage. This includes inflammation, also known as pelvic inflammatory disease or PID, scarring and adhesions, literally sticking together, which may block the tubes. Both of these bacteria increase the risks of tubal factor infertility. That's infertility due to problems with a woman's oviducts, which probably explains about a third of female infertility worldwide. Up to 85% of female infertility is due to tubal factors in sub-Saharan Africa, where these STIs are common. Whether STIs also reduce male fertility is less clear. Untreated syphilis enters the bloodstream and longer term re-emerges as destructive lesions in a variety of tissues. This is called tertiary syphilis. The health impact of tertiary syphilis will depend on which tissues develop lesions. Lesions in the nervous system can lead to dementia or seizures, while lesions in the heart can cause valve disease or block blood flow to the heart muscles. Some STIs, like trichomoniasis, chlamydia and gonorrhea, also make the infected person more susceptible to other STIs, such as HIV or AIDS. Trichomoniasis infections in pregnant women also increase their risks for premature ruptured membranes and preterm delivery. Women may also transmit STIs, including syphilis, gonorrhea and chlamydia, to their baby during pregnancy or at birth. This form of disease spread from mother to baby in pregnancy is called congenital infection or vertical transmission. Congenital infection with STIs may lead to spontaneous abortion, neonatal death, severe disability or chronic infection. Congenital syphilis is transmitted from the mother to the baby through the placenta during pregnancy. It can cause abortion of the fetus, usually when the infection occurs during the second or early third trimester of pregnancy. Congenital syphilis can also disrupt fetal development or cause severe disease in the newborn baby or later in life. The World Health Organization estimates that syphilis in pregnancy leads to over 300,000 fetal and neonatal deaths each year and places an additional 215,000 infants at increased risk of early death. People with STIs may not know that they have them, so they could infect others. Without symptoms, those who are affected are also more likely to suffer effects such as infertility because they may not seek treatment.